Thank you all for coming today. We appreciate it. We've got a pretty broad attendance here from our community nonprofits, service providers, probation, sheriff's office. We have two judges here today, Judge Janine Guy and Judge Heather Morris. I appreciate you coming. We have the police chief from Watsonville, and I'm sure there are other dignitaries here that I'm missing. But you're all very important to what is up ahead. This summer we saw the most sweeping criminal justice reform passed by the legislature that we've seen in the last 34 years through Assembly Bill AB 109. And this was prompted in part by the US Supreme Court decision finding the California prison system to be unconstitutional due to its crowded conditions and poor conditions of confinement. And we have the highest parole failure rates in the nation, with 70% of parolees, or close to 70% of parolees failing parole within the first 3 years. California was ordered to reduce the prison population by approximately 30,000 inmates, and locally, this will mean approximately 100 additional people in our county jails on a daily basis. And it will mean about twice as many folks under community supervision and in programs. So one of the things about this legislative action is that it requires the use of evidence-based practices. Fortunately, in Santa Cruz, we have been for the past dozen years implementing evidence-based practices in the juvenile side. In fact, we had Dr. Latessa come way back when we started about a dozen years ago. Since 2005, we've been implementing some of the evidence-based practices in the adult system. So we feel that very fortunate to have Dr. Latessa, who goes around the country talking about evidence-based practices here today, and this will help us meet the challenges ahead. And today really constitutes the beginning of an ongoing planning process that we hope to be very collaborative with our partners as we move forward to implement this program. And our hope is that if we do this right, that we will actually reduce recidivism and make our community safer. So a little intro to Ed Latessa. So Dr. Latessa got his PhD in Ohio. He is a professor and director of the School of Criminal Justice at the University of Cincinnati. He has published over 100 works in the area of criminal justice, corrections, and juvenile justice. He is co-author of 7 books, including Corrections in the Community and Corrections in America. Professor Latessa has directed over 100 research projects, including the study of day reporting centers, juvenile justice programs, drug courts, intensive supervision programs, halfway houses, and drug programs, and I could go on and on. He also has, through his research team, studied over 550 correctional programs throughout the United States and has provided assistance throughout the country in 40 states in workshops like the one we're about to have today. He was former director of the Academy of Criminal Justice Sciences, and he's been the recipient of many awards, which I won't go into because it would cut deeply into his lecture time. So with that, I'd like to introduce Dr. Latessa, and again, thank you all for being here. And by the way, thank you to the Rio Lawrence for allowing us the use of this place, and Community TV for filming the event. So, Dr. Latessa.
Thank you, Scott. All right. Well, good morning, everyone. They've asked me to stay on the stage because of the filming. I don't like to be on the stage, and if I fall off, please ship my body back to Ohio. I have been coming to California for many, many years. I've worked with a number of departments around the state. Scott and I were talking last night. It's probably been, I don't know, 8 or 10 years since I was in Santa Cruz. And this is one of the counties that I think has been held up as one of the more progressive model counties in trying to implement evidence-based practices. So you have a lot to be proud of here. There's been a lot of good work done. I understand now with the new bill that there's going to be more pressure on the county systems to handle offenders, and we're starting to get a lot of calls to come out and do some work. So, and I think there'll be some challenges, but at the end, I think it's the right thing to do. So what I'm going to talk about this morning is really about what works and what doesn't work in reducing recidivism. That's what I usually title these talks. What I want you to see as we go through this information is I'm going to talk about what are called the principles of effective intervention. And as you'll see, the principles have been derived from a lot of research over many, many years. What I really want you to see is their application across various populations, various settings, whether you're dealing with probationers or parolees, people in jail, people in prison, adults, juveniles, men, women. So the research is very clear in terms of guidance for trying to design more effective programs. Now, I've only got a few hours to go through this material, which is not a long time. It'll seem like a lifetime to you, but it's not a long time. We will take a break along the way, give you a chance to get up and stretch your feet, legs, and so forth. And I will try to leave some time for questions. It's not, again, I'm on the stage. I can't see you very well. But if you do have questions, even along the way, you may want to jump up. If you want to just testify, you can do that too. I may not recognize you, but some folks feel the need to do that. So with that said, why don't we get started? And it's really, I like to come at this almost like a story. I want you to kind of understand how we've gotten to where we are, at least in terms of this body of research. And I thought it's important because it is a diverse audience. That is, you're not just treatment providers. You're not just probation staff. Some of you represent other parts of the system, law enforcement and the folks that run jails and so forth. And so I think it's important to understand there are lots of reasons that we have criminal sanctions. We do it, of course, to punish people that have broken the law. They deserve to be punished in some cases, and that's part of why we have the sanctions that we have. We have beliefs in deterrence, both general deterrence and specific deterrence. General deterrence is, if you see somebody being punished, then you may refrain from that. We all saw how well that worked with the Enron guys, right? I mean, they all got punished, and then Wall Street straightened up and did everything right after that. Specific deterrence, of course, is where I've deterred you. If I punish you, the hope is that I've deterred you. Restoration has gotten some foothold in the system. It's popular for a while. It's starting, I think, to wane a little bit. But restorative justice ideas that, we need to involve the community, we need to involve victims, we need to make offenders pay back for what they did. We see it in the forms of everything from restitution to community service to sentencing circles and mediation and so forth. Incapacitation, of course, has been driving a lot of what we've done in corrections for the last about 30 years. California's been a leader in incapacitation. You've locked up folks. You have 3 strikes. You have an incredibly large prison system. And the idea, of course, with incapacitation is that we get people off the streets. Okay. Even if it's for a short time, we lock them up, we incapacitate them. Incapacitation can also happen in other ways, electronic monitoring and things like that. And finally, of course, rehabilitation, changing offenders' behavior by treatment and services. And in this case, the offenders choose to refrain from breaking the law rather than being unable to. All right? And so rehabilitation is part of what we do. All of these play some role in our correctional system. Let's talk just a little bit about deterrence theory. Deterrence theory, I call this an exercise in social psychology. There are some assumptions around deterrence theory. One is that the offender's aware of the sanction, that they perceive it as unpleasant, they weigh the cost and benefits, they make some kind of assessment of risk. If I do this, will I get caught? What will happen if I get caught? And then they make a rational choice. Those are some of the assumptions around deterrence. The problem is most street-level offenders are impulsive. They have a short-term perspective. They're disorganized. They have failed in jobs, schools, relationships, work. They have distorted thinking. They hang around with folks like themselves. They use drugs and alcohol. In short, they're not very rational. And in the face of that, deterrence theory collapses. It collapses. Incapacitation does show some effects with some types of offenders. So, for example, if you locked all the bank robbers in California up, if you could catch them all and lock them up, I can guarantee you bank robberies would take a nosedive. There's not a big market for bank robbers out there. Right? Eventually they'd be replaced, but it would take a while. But if you arrested all the drug users in California, they would be replaced almost immediately. There's almost an insatiable demand for drugs. And so we see some incapacitation effects with certain types of offenders. With other types of offenders, we don't see that effect. So incapacitation, the limitations of incapacitation, of course, are that it's very expensive to lock people up, and especially for long periods of time. It just costs a lot. It's not good social policy. And you're seeing it here in California, the fact that 30,000 folks are going to come out of prison. I always tell folks, whether you're on the incapacitation side or the rehabilitation side, you have to understand something, that most offenders are going to come out. It's like the old story. There was a family driving through Virginia in the fall, looking at the leaves on the trees, and they saw a big house. And as they got closer, it had a big sign hanging, and it said, Dr. Smith, veterinarian and taxidermist. And they got closer, it said, either way, you get your dog back. and it kind of typifies what we've gone through in corrections. We locked a lot of folks up, but now they're coming out. 700,000 a year coming out, and so now we're faced with this issue of how to deal with them. I'm going to talk about where the evidence has led us. And be clear, I'm a researcher. That's what I do. My work started to change now. We're doing more work with programs and redesigning programs. But at my heart, I'm a researcher. And as a researcher, I follow the data. If punishment worked better than treatment, I'd be up here telling you how to punish folks more effectively. I don't have any vested interest in what works and what doesn't work. It's what the data has told us. But I want you to understand what evidence-based is all about. The problem is that, first of all, everybody uses the term today, right? Every place you go, everybody's evidence-based, right? No one says, I don't know where the hell I got this program from. Okay. Every conference, somebody's talking about how they're evidence-based, and the term's almost losing its meaning now. There are different forms of evidence. There are different forms of evidence. The lowest form of evidence is anecdotal evidence. Case studies, right? Stories, opinions, anecdotes. You have a drug court here in this area? Huh? Yeah, and I'll bet you have a graduation. And I'll bet folks come, their families come, everybody comes up and they tell their story, and it's a very, very moving experience. People are crying, and some of them have turned their lives around. Everybody feels good about that. You should feel good about that. But that's just anecdotal evidence. That's all that is. Okay? So the highest form of evidence is empirical evidence, results from controlled studies, research. Doesn't always make us feel good. No one gets excited when I say there's a statistically significant difference at the 0.05 level, right? Let me give you an example. A number of years ago, we had a county in my state, had a big drug problem, and they had a judge in that county, he was a very powerful judge, administrative judge, and he decided he wanted to do something about that drug problem. So he started asking around, where could he find a good drug program that worked? And they sent him down to Miami Beach, right? What better place to go for a drug program? Mm-hmm. He goes down to Miami, and the judge down there tells him, I got just the program for you, acupuncture. And he trotted up some poor indigents who said, acupuncture changed my life. And based on that anecdotal evidence, that judge came back to Ohio, and he created an acupuncture program run by the probation department. In Ohio, probation's under the court. Look, something like this. They bought an old house down the street from the courthouse. Offenders who had serious drug problems were required to report 8:30 in the morning. First thing they did was pee in a cup. Second thing they did was get acupuncture, 5 spots in the ear. And then they spent the rest of the day in other activities, drug education, processing groups, 12-step. Other stuff doesn't work either with offenders, by the way. And they did that for a while, and they spent a lot of money. A lot of money. Every time they gave somebody acupuncture was $50, and people were lined up every morning. After about a year of that, they called me on the phone, and they said, Ed, we want you to evaluate our program. We want to know if it's working. Let me be clear. When folks in corrections ask me if a program is working, I usually know what they're asking. They want to know, is it reducing recidivism? Is it changing people's behavior? They're less likely to steal and hurt people and use drugs and do things that are going to keep them in the system. They don't really care if the offenders like the program. They don't care if they feel better about themselves. They don't care if the staff like the program. They want to know, is this increasing public safety in some way? So my job is to evaluate the program. That's not that hard. I had a whole bunch of drug offenders that went to the program. I had a whole bunch of drug offenders that didn't go to the program. Okay? And what's my hypothesis? The folks that went to the program are going to do better than the folks that don't go to the program. But then they said, we want to know if acupuncture's working. Now I had a problem, because everybody in the program was getting acupuncture, but they were all getting all that other good stuff. Think about it. How many of you work in probation? You drug test offenders? Yeah? You enforce the conditions? Give them good advice? Right? Can't give them enough of that good advice, right? So if an offender's doing well, is it because you drug tested them? Is it because you threatened them, send them to jail? Is it because you gave them good advice? You don't know. You throw everything you have at them, and you hope something sticks, right? That's how we typically do things, right? They wanted to know if acupuncture worked. To answer that question, I had to get them to allow me to do a random experiment. We randomly assign offenders to one of 3 groups. Okay? Acupuncture group. She came in the morning, she peed in a cup, she got acupuncture, she got all that other good stuff. Placebo group. Raise your hand so they can see you there. All right? Placebo group. He came in the morning, he peed in a cup, he got acupuncture in the wrong spot. It's okay. Okay, we'll give it to you for sexual dysfunction. And he got all that other good stuff. Control group. She come in the morning. Yeah, you, right there, raise your hand. Yeah. She peed in a cup. She didn't get acupuncture. She got all that other good stuff. Acupuncture, placebo, control. Acupuncture, placebo, control. That's how random assignment's done. The only folks who knew who were in which group was the acupuncturist and the secretary who kept the list. The POs didn't know, the offenders didn't know. Now, they knew who was in the control group. They weren't getting acupuncture. They didn't know the placebo or the treatment. To make a long story short, what did we find? Who had the lowest recidivism rate at the end of the study?
I did.
The control group. The control group. Acupuncture and placebo groups did worse. Now, if you ask why, it's basically because acupuncture is horse shit. Right? But, and don't come tell me it helped your neck and all that. You know, maybe it does. I mean, I'm not expert in acupuncture, but the question is, do you really think it's going to change behavior of drug offenders? Do you really believe that? We'd have acupuncture booths all over the country. But to me, it wasn't a question of why didn't it work. The question to me was, why'd they actually do worse? They did worse. The treatment groups did worse than the control group. And I've thought about this for a long time, and I think the reason those groups did worse was because those offenders thought they were getting some treatment that was going to fix them. They could do what they always did, hang around with the same people, think the same way, but they were getting this newfangled treatment was going to cure their drug problem. I'm telling you this story for two reasons. First, I want you to understand that's how we build knowledge. Those kind of studies. Empirical studies, control groups, rigorous design, that's how we learn. Now that was one study in one county. But what happens when other people do studies of acupuncture and they find no effect? What are we going to conclude after a while? Probably doesn't work. Second reason I'm telling you that is because not everything we do in the name of treatment is effective. We can actually do harm. We can increase failure rates. And we can do it with treatment. So I want you to understand this as we move into this. If it was simply go do treatment, I could stop now and say, just go do good things to them. Be nice to them. Unfortunately, it's not quite that simple. It's really, there are different ways folks go about evidence-based practices. The way I tend to do it is to really think about evidence-based decision-making. It involves steps. It involves the use of validated tools and curriculums. But it's not just having those tools. It's how you use them. It's like going out. You know, you can go out and buy a canned program. You can read websites that say, you know, the feds like to put out model programs. This program's been found to be effective in Denver. Go get it and you'll be fine. I don't think it's going to be that easy because you have to understand how to use them. There are some steps. There are some steps involved in evidence-based decision-making. It starts with good assessment. By the way, almost anything you try to fix starts with good assessment, right? Your car. You take your car to the mechanic. You want them to hook it up to the computer. You want them to ask you what kind of sound it's making, right? You go to the doctor. You want them to take your blood pressure, your temperature, ask you some questions. Right? Assessment is the first step. Second, of course, is what's the research say? If you're going to do an intervention, you're going to do some treatment, shouldn't you know what the research says about the effectiveness of that approach? Again, it'd be like going to the doctor. If you had a heart condition, you went to your doctor said, I don't know anything about heart conditions. I got a few ideas, though. I got them from my neighbor, little Italian lady. What are most of us going to do if our doctor says that? We're going to find another doctor. That's right. I want my doctor to base my treatment on research. I don't want them making it up as they go along. Third, of course, is available programming. Are the programs available? Here you have a lot of programs. There's some places that don't have the programs. They only have a few programs. Maybe they have one program. All the more reason, in my mind, that that program needs to be doing the right things. Evaluation. And I don't mean big outcome studies, things like that. Those are rarely done. I mean evaluating yourself, collecting information to make sure what you're doing is getting you some effect. If you're trying to reduce substance use, that's not hard to measure. We do drug tests. you're trying to increase employment. You can track that. Reduce risk. You can look at risk scores over time. And the reason I'm telling you this, because at the end of the day, to truly be evidence-based, you have to be data-driven. You can base what you're doing on the research I'm going to talk about. But at the end, you've got to look at yourselves. You've got to have ongoing data. And good programs, why do they do it? Because they can make adjustments. Or they can say, you know, it's not working well with this group of people. Maybe we have to change the dosage, or maybe we have to deliver the treatment somewhere else. And of course, professionalism and knowledge from the staff. At the end of the day, it's the staff that have to understand how to apply this work. It's great that Scott is committed to evidence-based practices. That's important. You've got to have leadership. But my guess is he doesn't have a big caseload. All right? He's not sitting across from offenders. Okay? And so it's important that at the lowest level you understand how to apply this work. All right, so what does the research tell us? As I said here, there's often a misapplication of research. If you believed every study you wouldn't eat anything, you'd just drink a lot of red wine. And obviously, in this part of California, you've been following that advice for a long time. Okay? Think about it. Every night if you watch TV, something comes out that's bad for you, right? Eat this, it's bad. I heard the other day, coffee's good if it's fresh. Right? I don't know if that's true or not. Right? Here's a way to think about a body of knowledge. That's what I'm trying to get you to understand, is not one or two studies. You can find a study to support anything you want. What does a body of knowledge say? Here's a way to think about it. How many of you think cigarette smoking is bad for your health? How many of you have read all the research that's been published over the last 50 years on the effects of smoking in healthcare? Right? Not too many folks. Do you know there are some studies that say it's not that bad? There are some studies out there. They were funded by the tobacco industry. Mm-hmm. But why don't most of us believe those studies? Why do most of us believe today smoking is harmful? Well, it's because over the last 50 years, there have been hundreds of studies done all over the world by independent researchers who have basically concluded if you smoke a lot, it can lead to cancer, emphysema, heart disease, and other problems. There is a body of knowledge. And smoking, by the way, is one of those interesting areas where our anecdotal evidence lines up with our empirical evidence, doesn't it? We've all known people that have had health problems from smoking. We all know people that died prematurely from smoking, right? So that anecdotal evidence and the empirical evidence line up. You don't think we know anything about offenders? You don't think we know anything about correctional programs? We've been studying this for many, many years. There are thousands of criminologists in this country who do nothing but study offenders. There are thousands of studies published every year. Now, that's part of the problem. How do you keep up? How do you sift through that research, right? Well, that's what I'm going to do for you today. I'm going to basically summarize what that research tells us about offenders, offender behavior, and reducing recidivism, right? First thing we note is there's not a single reviewer of studies of punishment alone that have shown consistent evidence of reduced recidivism. This doesn't mean there aren't studies out there that show some effect of punishment. It doesn't mean that some people don't deserve to be punished. It doesn't mean we're not going to punish people. It simply means when researchers look at all that research, we don't see a lot of consistent evidence that you're going to change a lot of people's behavior with that. 40 to 60% of studies of correctional treatment report reduced recidivism to various comparison conditions in every published review. That's good news and that's bad news. The good news, 40 to 60% of published studies show some effect from treatment. The bad news, 40 to 60% of studies don't show any effect of from correctional treatment. The opposite of that. And I'll let you in on something here. Published reviews. Guess what usually gets published? studies that are showing some effect, right? People aren't interested in reading about programs that don't work. I think it's closer to 25% myself. That's what my research would say. About 1 out of 4 programs, if somebody came in and really did a controlled study, they'd show an effect. But it doesn't matter. Let's say it's 50%. You know what that means? Half the programs you have don't work. You got the same effect by basically doing nothing. So, first thing we know is treatment, stronger effects than punishment. And this is what we see when we do what we call meta-analysis, lots of studies. I won't go into detail. But basically, we get modest effects from treatment. We get slightly negative effects from punishment. By the way, almost identical when we look just at youthful offenders. I want you to see how similar the results are. Now, why we would think they're different. Most adult offenders started out as juvenile offenders anyway, so it shouldn't surprise us by any of that. And by the way, these are the people who appear to be resistant to punishment. Psychopathic risk takers, those under the influence of a substance, and those with a history of being punished. And who is that? It's an offender population, right? And so I'm only pointing this out to you because I want you to understand that the problem with punishment alone is it doesn't work very well with the people we want it to work most with. Okay? It would work with you. I could change most of your behaviors through punishers, at least for a while. You'd respond because you have a lot to lose. You don't want to lose your jobs. You don't want to lose your family. You want to lose, your freedom. Those things are important to you. Okay? But the higher the risk offender, the less chances this makes any difference to them. I always tell folks, a good example is jails. Jails are a good example. I will take bets that if you go to any jail in California on any given day, 80% of the people in that jail have been there before. If it works so well, why do they keep coming back? Again, most of us would never want to be locked up. Right? But for people that are in that are higher risk, that's just part of the process for them. It's part of the lifestyle. Researchers like myself who've studied these things have concluded that without some form of human intervention or services, there's unlikely to be much effect on recidivism from punishment alone. But let me say this, though, and this is an important point, I think. We don't do treatment in isolation from punishment, usually, in our business. Right? A lot of the people in drug court, they wouldn't be there if somebody wasn't holding something over their heads. Right? The chance to get out of their charges, the chance to not go to jail, so understand we're kind of unique in that way. Most treatment's coerced, by the way. Even voluntary treatment, most of it's coerced. Most of us don't wake up someday and say, that's it, I'm changing my life. Somebody's pushing. Your spouse, your kids, your doctor, your friends. It's common to have some push there with it. But we're kind of unique in that in the criminal justice system, we don't give them a lot of choices usually. Okay? And we still get effects. We still get treatment effects. It's a myth that we can't coerce treatment. We can coerce treatment. Okay? The evidence also indicates, while treatment is more effective in reducing recidivism, that not all treatment programs are equally effective. When we look at these data and divide it into type of treatment, we see big differences in what we call effect sizes. The larger the effect size, the greater the reduction in recidivism. Non-behavioral programs, and by the way, that's most of what's out there, are minimal effects. What are non-behavioral programs? Things like talk therapy, educational programs. Get a bunch of drug offenders and educate them about drug use. It's really a dumbass idea when you think about it. But we do it all the time. We take violent offenders and we teach them about violence. Take drug offenders, teach them about drug use. Take gang members, teach them about gangs. Not a very effective way to change somebody's behavior. Or we can talk to them about it. Why do you think you're here? What do you want to talk about tonight? Let me give you some insight. Again, not very effective. Behavioral programs have some characteristics. We'll talk more about it later. But they have a couple characteristics important for you to remember. First, they focus on current risk factors, not the past. Current risk factors: you're not going to work, you're drinking too much, you hang around with the wrong crowd, you think what you're doing's okay. Those are current risk factors versus the past, which sometimes can be a barrier, but we can't change the past. And so talking about past behavior, talking about trauma, talking about events they can't control won't get you very far. Second, behavioral programs are action-oriented, not talk-oriented. What do I mean by that? They are attempting to teach offenders new ways to behave, new skills, and that's done through a very interactive process. Offenders have skills. It's a myth they don't have skills. Lying, cheating, stealing, using drugs, those are skills. They get a lot of reinforcement from that behavior. We're trying to do what? We're trying to replace that with pro-social ways to behave. And how do most of us learn new skills and new behaviors? Somebody shows us. We practice it. Okay? And it's the same with offenders. So, two important points of behavioral interventions. And the differences are dramatic in terms of effect sizes. This is a 30% effect size on average. Juveniles, we see the same thing. Behavioral, non-behavioral. Women, behavioral, inappropriate. So you want to get the strongest effects, we use behavioral interventions on all populations. All right, so first thing we learn from the research is we get effects from treatment. The effects seem much stronger when we do behavioral treatment. Okay. The third body of knowledge is the work on risk factors. Extremely important. Extremely important. And I think we go wrong here. This is where we commonly go wrong, I think. And I think there's a number of reasons for it. One is our training sometimes narrows our focus. Let me give you an example. If you're trained in substance abuse, what are you looking for? Substance abuse. If you're trained in mental health, what are you looking for? Mental health, right? Read a psychiatrist's report on an offender. It's always about, depression, anxiety, things that have very little correlation with risk, by the way. But that's what they're trained to look for. The second problem is everybody's an expert. Now, I don't mean you. Most of you are experts. You work with offenders all the time. But I mean everybody thinks they're an expert about crime, right? Think about it. How many of you, your friends and family, tell you how to do your job? Tell you what you ought to be doing to fix these folks, right? I get it all the time. I was on a flight one time. I was flying to Boise, Idaho, and I was seated next to some elderly woman. She was one of these chatty types, wouldn't take a hint. And she asked me what I did for a living, and I made the mistake of telling her. And for 4 hours, she told me how to solve the crime problem in America. Didn't get off the plane in Salt Lake, stayed right on with me to Boise. Never forget, yeah. Now I just tell them I'm a proctologist, they leave me alone. But this work is important because it's telling us what to target. When I first started doing these presentations, probably the last time I was back here, I would have spent a lot of time going through the meta-analysis, going through the studies, convincing people. I don't do that anymore. I don't have time to do it. And if it doesn't make sense to you, those of you that work with offenders, then you let me know that. Okay? But what I want to talk about are what we call the major set of risk and need factors. Starting with antisocial, pro-criminal attitudes, values, beliefs, and cognitive emotional states. Cognitive emotional states are things like rage, anger, defiance, criminal identity. If you see yourself as a thug, how are you going to act? Rage, you've all experienced it. You've been cut off on the freeway. You're going to go after that guy. You're mad. I mean, that's not how you normally think. You're in a cognitive emotional state of rage. Pro-criminal attitudes, values, and beliefs are what people think. It's not how they think. It's the content of thought. And these are the things that you listen for. Negative expressions about the law. The law is unfair. Everybody does it. I got caught. Negative expressions about conventional institutions, rules, authority, things like work, school. I interviewed an offender the other day, a parolee, and I asked him if he was working. He said, no, I quit my job. I said, why? He said, I wasn't getting enough hours. I said, how many are you getting now? And he said, none. And I said, well, you're kind of moving backwards, right? Most people don't quit their job till they have another job lined up. Not him, he showed them. He went from 20 to 0. It's that kind of distorted thinking, not thinking through the consequences, that often get them into trouble. They don't have that long-term thought process. Negative expressions about problem solving and the ability to achieve. You hear them say, 9 to 5 things never been for me. I'm not into that school stuff. I've never been good at that. We think that's low self-esteem. What they're really saying is, who the hell would want to do it? And of course, that cold-heartedness, lack of empathy and sensitivity toward others. They don't see who they hurt. What do they say? If they didn't want drugs, they wouldn't have bought them. Right? But they don't see their family, the people that care about them. They don't see those folks. They think it's all about them, by the way. Offenders often neutralize, minimize their behavior. These are a set of verbalizations that function to say, what I did wasn't so bad. It's a way of kind of lying to yourself. Now, there's some good to this. This means when they are minimizing, there's some guilt there. And it gives you, if you're in treatment, it gives you something to hang your hat on. But these are things we hear. Deny of responsibility. Criminal acts are due to factors beyond the control of the individual. What do you hear? I was at the wrong place at the wrong time. I was high, I don't remember what happened. My favorite, the some dude defense. Some dude told me I could drive that car. We are looking for some dude. If we ever catch him, we're going to reduce crime 20% in America. Deny of injury, admit the act, but minimize the harm. I beat him up, I've been beat up worse. I stole their stuff, they got insurance. I just drove the car till it ran out of gas. So that minimizing the harm that was done. Deny the victim, reverse the role and blame the victim. Two good ones at this are domestic violence offenders and sex offenders, right? Domestic violence, they'll meet you at the door to tell you why they shouldn't be there. Right? System bashing, those who disapprove are immoral, hypocritical, or criminal themselves. Certainly you've done these things, right? You just haven't gotten caught. And finally, of course, the gang member mantra, they live by a different code. Demands of larger society are sacrificed for more immediate demand. These start here, they emanate here with our cognitions, how we see the world, how we see our behavior, whether or not we accept responsibility for it. Number 2 on the list is one we're all familiar with, who you hang around with. Your mothers all knew it. If you're a parent, you know it. You worry about who your children hang around with. It's not just knowing criminals. If that were the case, some of you'd be criminal as hell. It's not having pro-social people in their lives. When you assess an offender, you don't just want to know who are the antisocial people, who do they get in trouble with. You want to know who in their life doesn't get into trouble. Because now your role is not just keeping them away from their bad friends, and by the way, that's very limited. You have a limited ability to do that, right? We have all the rules, can't associate with known felons, can't be here, put them on curfew, right? But the minute you go away, that goes away. And they go back to their old friends. What you've got to start to do is work on replacing those antisocial associates with pro-social ones. And there are ways to do that, and some of them aren't expensive, but there are ways that start thinking about doing that to increase it. Number 3, temperament and antisocial personality factors that are conducive to criminal activity, including weak socialization, impulsivity, adventurous, pleasure-seeking, restlessly aggressive, egocentrism. Most offenders high-risk offenders don't suffer from low self-esteem. That's a myth. It's high self-esteem you have to worry about because it gets, right? We put them in programs to make them feel better about themselves. We're making them more narcissistic. Okay? Below average verbal intelligence, mostly men can't articulate needs well. A taste for risk and weak problem solving and lack of coping skills. I want you to look careful at these factors because I'm going to show you a study in a minute, and I want you to see what they found in relation to these risk factors. Right? Now, the good thing about this list is these are really all amenable to behavioral treatment. I can teach you how to be less impulsive. We can work on problem-solving skills. We can work on coping skills. Right? So these kind of traits really lend themselves to teaching offenders new skills. Number 4, of course, one we're all familiar with, history of antisocial behavior. The younger they started, the more trouble they've been in. What? The higher the risk. That's an easy one. It's an easy one. But there's some limitations to risk, to history. Okay? First limitation is you can't change it. Right? I mean, a guy's been arrested 5 times, 6 times, been in prison, been in jail. He's always going to be in prison, been in jail. That doesn't help you in terms of the targets. Second problem with it, if you over-rely on it for your assessment, a second problem's a little different, is you got to have it before it's useful. Let me explain what I mean. I used to study habitual drunk drivers. You probably don't have any of them in California. Right? But I used to study them in Ohio, and I'll let you in on a secret. You don't need a PhD to know someone with 5 DUIs is high risk for drinking and driving. How do you know it, by the way? I got 5 DUIs. That's how you know it. Right? But here's the problem. At one point, they had 1 DUI. They were high risk the minute they walked in the door. But you didn't know it. Okay? In Ohio, we have mandatory jail or programming for first-time DUIs, right? It's a film festival program, right? But here's what we do. Here's what happens. 80% of the people that go in that program are never going to drink and drive again because they look like you. They don't want to lose their license and their jobs and their insurance and their families ashamed of them, right? But then you got that 15, 20% who say things like, I drive better drunk. I only had 20 beers. Cops had one of them roadblocks set up. I should have went a different way. And they're the ones, and they often have drinking problems, that continue their behavior. Okay? So I'm just telling you this because once somebody has 4 or 5 priors, it's easy to look at their risk. The key is, can we identify earlier on some of those risk factors and then make appropriate decisions? Number 6, family factors that include criminality and a variety of other psychological problems in the family, including low levels of affection, caring, cohesiveness. For kids, it would include poor parental supervision and discipline and outright neglect and abuse. Family criminality is a risk factor, but it can't be changed. I can't change the fact your father's in prison. Helps explain why you're here, but doesn't help me. I can't change that. But this area we can work on. 6, low levels of personal, educational, vocational, or financial achievement. The key word there is achievement. As you're going to see, it's not about getting a job. It's how you view work, how you work your job, how you care about work. 7, low levels of involvement in pro-social leisure activities. This allows for interaction with antisocial peers if you have nothing to do. You have idle time, and they often replace pro-social behavior with antisocial behavior. And finally, abuse of alcohol or drugs. Drugs are illegal in and of themselves. Engage with, usually they do it with others, and it can impact their social skills. Those are the major set. There are minor risk factors. There are minor risk factors that can contribute to risk. But these are the major set. These are really the ones that you want to include in most of your interventions. I want to just take a minute and show you this study. It just came out. Because what I'm trying to show you here is how strong antisocial attitudes, values, and beliefs are. This was a study done of criminal thinking and mental illness. Researchers from Rutgers studied 414 adult offenders, males and females. They basically compared, they identified offenders in prison who had been diagnosed mentally disordered and compared them to non-mentally disordered offenders in prison. And what did they find? The mentally disordered offenders not only had criminal attitudes and attributes, but they scored higher than the non-mentally ill offenders. What did they conclude? Incarcerated persons with mental illness are both mentally ill and often criminal. And that needs to be treated as a co-occurring problem. I go into these jails, they want to identify mentally ill folks, get them on their treatment, get them out. They're all back in 6 months. Why? Well, because nobody's dealing with those other antisocial attributes. Mental illness shows that really no correlation between that and criminal behavior. But there's more mentally ill people in the system all the time because we've closed all our mental health programs, and who's going to come? The cops always come when you call them, right? So they take a while sometimes, but they always get there, right? I want to show you this study, and this is, I think, very relevant for California because you're about to let a whole bunch of folks out of prison, and as Scott said, you have among the highest failure rates of parolees in the country, and most of those are technical violations, by the way, so that's what's going on there. This was a study done Pennsylvania Department of Corrections a couple years ago in which they wanted to identify parole violators and see what was different between them and the folks that made it. This is what they found in Pennsylvania. Violators, more likely to hang around with individuals with criminal backgrounds, less likely to live with a spouse, less likely to be in a stable, supportive relationship, and less likely to identify someone in their life who served in a mentoring capacity. Right? Think about family, think about having offender friends, non-pro-social friends, they're showing up. In terms of employment and financial situation, violators were only slightly more likely to report having difficulty getting a job. It wasn't significant, but they were less likely to have job stability, less likely to be satisfied with employment, less likely to take low-end jobs and work their way up, like many of us have, more likely to have negative attitudes toward employment and unrealistic job expectations, less likely to have a bank account, and more likely to report they were barely making it, yet the success group reported over double the median debt. It wasn't about getting a job. It's about keeping a job. It's about working a job. It was about valuing work. Many of the offenders that were making it were working too low-paying jobs to support their families. And I always like to say, you know, if you had to support your family, most of us would take any job if we really, truly had to do it. You ask a lot of offenders that question, and you see what you get. I'm not working for $10 an hour. Okay. Drug and alcohol use. Violators more likely to report use of alcohol or drugs while on parole, but no difference in prior assessment of dependency. What was the difference? Poor management of stress was a primary contributing factor to relapse. It didn't differ on prior use of drugs. They differed on their ability to cope when they got out. And those are things you can work on. Those are things you can practice. Because the failures, what happened was they got into tough situations and they did what they always did. Go get high. Go get drunk, right? I mean, things that got them into trouble. In terms of attitudes, they had unrealistic expectations about what life would be like outside of prison. They had poor problem solving or coping skills. They did not anticipate long-term consequences of behavior. They failed to utilize resources to help themselves. They acted impulsively to immediate situations. They felt they were not in control. They were more likely to maintain antisocial attitudes. They viewed violations as an acceptable option. What else could I do, they said. The guy got in my face. Right? Maintain general lack of empathy. And shifted blame or denied responsibility. So there we see those attitudes, those values, those beliefs shining through with the failures. Finally, they did not differ in finding a place to live or in finding a job. A lot of reentry going on in this country now, pouring a lot of money into it. You know what most of them focus on? Find them a place to live and get them a job. That's important. I mean, everybody needs a place to live, but didn't distinguish the failures from the successes. It was those other attributes. And if I were California and I had 30,000 people coming out of prison, I'd be paying attention to what Pennsylvania found. Because it clearly has implications for how you prepare people for release prior to coming out, as well as what you need to do with them once they hit the streets. I put this chart together because for a couple reasons. First, I want you to see how it translates. So you have a history of antisocial behavior. That's the factor. The risk is early and continued involvement. But here's the dynamic need. You need to build non-criminal alternative behaviors in risky situations. What's that mean? Well, that means you break it down for them. When do they get in trouble? Let's practice and rehearse how you could have handled that differently. So that's an example of where you can use kind of those events to practice for the future. Then you've got personality, cognitions, associates, family, school, leisure, recreation, and substance abuse. I want to be crystal clear about this. Most researchers like myself who study these things believe that these four run through these four. These are the big four. If you can change these attributes, these other ones come. But what do? We focus here. These are the easier ones to identify and work on. Harder to change who somebody's hanging around with. Harder to change their thinking. Right? So what do? We put them in a substance abuse program. All their friends use drugs. They never worked a day in their life. They think what they do is okay. Right? And we go clean them up for 30 days. Who picks them up? Friends. Yeah. Their friends, they're high before they leave the parking lot. So I think what we have to start doing is we have to start focusing our core programming around these areas, and then these often come into play. Because if I've changed your attitudes, I've changed your social support systems, I've changed your friends, and made you less impulsive, give you better coping skills, you want to hang around with your family, you want to get a job, you want to go to school. Those things start to come into line. But I think we kind of oftentimes go about it kind of piecemeal. All right, how are we doing here? All right, we're going to start this and we'll take a break. All that was really background. It's really background. I wanted you to see kind of how we've gotten here. So we have this fundamental research that says we get some effects from treatment, we get stronger effects if it's behavioral, and we've identified what we call the major set of risk factors. Now we've gotten some principles that have been identified. These are the principles in a nutshell. The risk principle. Target higher risk offenders. That's the who. The need principle. Target criminogenic needs and risk factors. That's the what. The treatment principle. Use behavioral approaches. That's the how. And fidelity. Make sure the programs are implemented as designed. That's the how well. Who do we target? What do we target? How do we do it? And how well we do it all makes a difference. Let's start with the risk principle. First thing you got to understand is risk refers to the risk of reoffending, not the seriousness of the crime. You can be a high-risk felon, you can be a low-risk felon. You can be a high-risk misdemeanor, low-risk misdemeanor. High-risk sex offender, low-risk sex offender. We all understand the differences there. You're all low risk. Even if you committed a crime, even if you committed a serious crime, you were to get assessed with almost any risk assessment instrument, you'd score low risk. Why? Well, let's see, you're employed, you're educated, you have family, you don't have criminal records, you don't hang around with criminals. Well, maybe you do a little bit. Right? But, you don't have a lot of risk factors. Doesn't mean you didn't commit a serious crime. Doesn't mean you're not going to be punished for it. It simply means I don't have to do a lot of treatment to lower your risk. Hell, I'll probably get the effect just from punishment. Okay? Understand, seriousness always trumps risk. Seriousness always trumps risk. You commit a violent crime, it probably doesn't matter you're low risk. You're probably going to be punished for that. All right? I understand that. So there's sometimes low-risk people get punished severely. It's not because of their risk, it's because of what they did. We have to understand that. It's not just about your chances of doing it again. It's also about what you did. And we have to understand that's important. But in my context, I'm going to talk about it as the risk of reoffending. This is what it looks like in an actuarial distribution of risk based on a community sample. All right? So this is a risk assessment tool that we developed, and this is the three of the categories it produces. It actually produces a very high risk, but I'm just showing you these three. Low risk, moderate risk, high risk. Low risk offenders, 9% of them reoffended. I don't know which 9 will reoffend. If I have 100 offenders, about 9 or 10 are going to get in trouble again. I don't know which ones. We can't predict to that level. No one ever will or can. Moderate risk, about a third reoffend. High risk, now we're losing the bet. Over 50%, in this case 60% reoffend. Why would we focus on this group? How are we going to get it much lower? You're not. So we want to put our energies, our resources, our programs into who? Higher risk people. The risk principle is really quite simple, if you will. If in a normal state, if half the people coming out of prison recidivate, which half are we worried about? The half that will or the half that won't? The half that will. Notice I said normal state because you're up around 80%, all right? But that's the risk principle. If half the people coming out of your jails never come back again, which half are we want to focus our attention on? The half that will come back again. That's essentially the risk principle. Okay? The three elements to the risk principle. Target offenders with a higher probability of recidivating. Provide most intensive treatment to higher risk offenders. And 3, the problem. Intensive intervention and treatment to lower risk offenders can increase failure rates. If it wasn't for this finding, we could just do everything with everybody. All right? Just give them all double, super duper, intensive everything. It's not very efficient, but we wouldn't do harm. Let's walk through these. First thing I want people to understand is that when you target higher risk offenders, and we need to target higher risk offenders, whether it's in the community or in jail or in prison, because most of them are coming out, we need to reduce those recidivism rates. Okay? It's important to understand there's still going to be failures. I don't have a magic wand. Okay? And even if you reduce recidivism rates significantly, you're still going to have a fairly high percentage of failures. Okay? People have to understand it. They're talking about a group that fails at 60% or higher. If we cut that by a third, we're still going to have a lot of failures. This is how the risk principle in theory plays out. If you have 100 high-risk offenders, about 60% will fail. You put them in a well-designed, evidence-based program for sufficient duration, you may reduce failure rates to 40%. That's a 30% reduction in recidivism. You went from losing the bet to winning the bet. If you have 100 low-risk offenders, about 10% will fail. If you put them in the same program, failure rates will be about 20%. So you'll double their failure rates. But here's my question. In the end, who had the lower recidivism rate? Let's go back and look. Who had the lower recidivism rate at the end? Low risk. They failed at half the rate of high risk. Even if you screw some of them up, they're not going to do as bad as the high risk group. Okay? But here's the mistake we make. The mistake we make is we're often comparing high risk offenders to low risk offender. We think we're doing well. When you get low risk offenders, right, they're easy to work with. They show up, they pay their fines, they have clean urines, they have jobs, right? High risk, they're a pain. Right? They're the ones that show up and say, is this going to take long? Like they got somewhere to go. You know? We make this mistake all the time. We make it in treatment. We make it in supervision. Okay? We think we're helping low risk. We're actually increasing failure rates. Okay? Let's talk about this second element. Whenever I was here before, I can almost assure you what I would have told you. I would have said that you needed to give offenders at least 100 hours of treatment, and that the most effective time period was about 3 to 9 months. If we don't see much effect from real short interventions. If you keep people in treatment too long, the effects go down because they give up. Right? So that's what my advice would have been to you. Now we've got some new research that's basically looking at this question of dosage. And really, think about it. It's a fundamental question. How much treatment does somebody need to get the effect? I got thinking about this a long time ago. You know, you go to the doctor, maybe you have an infection, and they give you a prescription. And the prescription says, take until finished. They want you to take them all. And your doctor says, even if you're feeling better, make sure you take them all. Right? If you're like me, you save some for when you're sick again. Okay? I got a whole medicine cabinet of stuff. I don't know what it is anymore. But why do they do that? Because they know, their research has said this is a difficult infection to kill. If you don't take it all, it may come back. If you ever have cancer, heaven forbid, you're going to get a very strict regimen of chemo or radiation. If they give you too much radiation, it will kill you. If they don't give you enough, it may not kill the tumor. Same with chemo. And that's a dosage issue. And I've always thought we've never done a good job of measuring that in our business. We measure time. We measure time, but we don't measure dosage. And so I got some guidelines for you, and there's been a couple studies now. I'll show you one in a minute that we just did. Rule of thumb, about 100 hours for moderate risk offenders. And when I say 100 hours, I don't mean work, I don't mean school, I don't mean, non-evidence based. I mean 100 hours of structured skill building, working with that offender, reduce their risk. It can be in groups, it can be individual, but that gets you your effect. High risk, double it, at least double it. And here's why. 100 hours for high risk will have little effect. A lot of programs, in my opinion, are not getting their effects, not because they're not doing the right thing, they're just not doing enough. We tend to be a one-size-fits-all business. All right, let's be honest about that. Talk about individualized treatment. Everybody gets the same thing. Okay? I was up in Oregon a while back looking at a program for women, an institutional program. They were there 6 months in that program. In 6 months, they did 4 hours a week of what I consider to be evidence-based programming. 4 hours a week. Everything else they did was horse shit. 4 hours a week. If you do the math, that's about 100 hours of treatment. Here's the problem. 9 out of 10 of those women were assessed as high risk. And there was no reason for it. I mean, this was a 24/7 program. They could have easily doubled the treatment, easily. We recently did a study of 100-bed secure residential facilities, adult male felons. Just give you some of the background on the offenders. Most were moderate or high risk. It was a COG program. We only counted the hours that were spent in evidence-based programs. This is what we found, basically. Increasing the dosage for moderate risk offenders had a minimal effect. Didn't get you much, but look at it, high risk. Look at the difference, 81 to 57% drop. So, the results weren't as strong for moderate risk offenders. That means you can put them in that 100-hour program, you'll get your reduction, but you've got to have at least 2 tracks. You've got to have a track for high risk. I was up in Lansing, Michigan a while back, East Lansing, and the juvenile court there, we went and did some work there years ago, and I went back to take a look at what they were doing. And they had a program, basically a day reporting kind of program for kids. And it was a 5-day-a-week program, 4 to 8 every day. Here's what they did. Moderate risk kids went Tuesday and Thursday. High-risk kids went Monday, Wednesday, and Friday. So with one fell swoop, they increased the dosage of treatment for high-risk kids, and they kept the moderate and high-risk kids separated from each other. So just little things like that sometimes can get you that increase. Okay. This, of course, supports the risk principle and indicates we cannot have a one-size-fits-all programs. All right, the third element, intensive treatment for low-risk offenders will often increase failure rates. 2 reasons we think this occurs. 1, low-risk offenders will learn from high-risk offenders. It doesn't work the other way around. Okay. Again, think of yourselves. Would you put your teenager in with a group of high-risk gang members? No? Why not? Maybe your kid rub off on them. We'd never do that as a parent, right? We do it all the time, right? I mean, we lock kids up in detention to teach them a lesson. We put them in with high-risk kids. I mean, we do it all the time in the criminal justice system. The second reason, though, is that when you put low-risk people into intensive interventions, you disrupt what makes them low risk. Let's go back to you. You're all low risk. If I took you right now and put you in the best correctional treatment facility in California for 6 months, how many of you would lose your jobs? How many of your families would have trouble getting by without you? How many of your neighbors would have a welcome home from the correctional treatment facility reception for you? In other words, I wouldn't reduce your risk. I'd give you some new risk factors. So I want you to understand kind of why we think we see these effects. This is what we see from meta-analysis. Average effect for high risk, about 20%. Low risk, slight increases. This is a study out of Canada that was done a few years ago, looking at intensive rehabilitation supervision. High-risk offenders who were put into that program had a 31% recidivism rate. High-risk offenders who were not put in that program, 51% recidivism rate. They reduced recidivism 20%. But look at this. Low-risk offenders who were put in the program failed over twice the rate as low-risk offenders. Now, I know what you're thinking. That's Canada. They only have like 20 offenders in the whole country. I'll give you that. 2002, I did what was then the largest study ever done of residential community correctional programs, halfway houses, and what we call community-based correctional facilities. This study had 13,000 offenders in it. We did a 2-year follow-up. I'll cut right to it. Every offender was given a risk score. I didn't want to compare low-risk offenders to high-risk offenders. I wanted to compare low-risk offenders to low-risk offenders, high-risk to high-risk. And so our treatment group were offenders who were placed in these 24/7, very expensive programs. Our control group were offenders who only got supervision. So they did not get this 24/7 kind of treatment. Okay? They got treatment. It just wasn't this intense version. These are the treatment effects for low-risk offenders. These are the programs. They don't matter to you. All right? These red bars are how much worse low-risk offenders did when they were placed in those programs. You can see most programs increased recidivism rates for low-risk offenders. Same programs, the effects for high-risk offenders. Now you see the opposite. Most of these programs reduced recidivism for high-risk offenders. We did have 8 programs that did not work with anyone. Anyone know what the scientific term for that is? Shitty program is the scientific term for that. Here's where you see the risk principle down here. Let's just take this one. This program, this is where I grew up. 32% reduction in recidivism for high-risk offenders, 29% increase for low-risk offenders. So the same exact program was reducing recidivism significantly for high risk, was increasing recidivism for low risk. And the sad part was when you put their data together, they looked like they had no effect. 2010, Ohio had us replicate the study. Bigger study, 20,000 offenders, 44 halfway houses. Probationers, parolees, both were included in the study. Okay. What did we find? Basically the same thing. Most programs increased recidivism for low risk. This one increased it by 50%. High risk, most of them reduced it. You can see here now in Ohio, 1, 2, 3, 4, 5, 6, 7 programs reduced recidivism over 50% for high-risk offenders. These programs here, the state canceled, put them out of business, canceled their contract, shut them down. They said we can't keep spending money on programs that don't work. Overall, increased recidivism 3%, reduced recidivism 6% for moderate risk, and for high risk, 14%. And you say, oh, 14%, not that big a deal. There were 20,000 offenders in this study. You do 15%, you're doing pretty well. Okay? And remember, we can do better. Some of those programs did better. So I want you to see the risk principle. It's one of the strongest principles we've had. We've seen it with sex offenders. We've seen it with women. We clearly see the need to focus on high risk and to minimize what we do to low risk offenders. If not, we do harm. Okay, it's about 1:30, so we're going to take a break. 15 minutes, that's it. All right, that's all Scott has allocated. I will start talking at 22. I've got a lot to cover here in this fairly short amount of time. So I want to move now into what's called the need principle. The need principle basically says you want to target criminogenic needs for change. When we talk about risk factors, and we'll talk a little more about different types, But criminogenic simply means crime producing. All right, just a fancy way to say that. These are factors that have been shown to be correlated with criminal conduct. Things like antisocial attitudes and friends and substance abuse. Non-criminogenic are areas that have very little correlation. Things like anxiety, low self-esteem, creative ability, medical needs, physical conditioning. Okay? It's not that people don't have those needs. Sometimes they can even be barriers, but they're not correlated. Anxiety. I have a friend who works with, she's a psychologist, and she works with parolees. And she had a parolee that came out of prison. He was a bank robber. And she asked him, you know, what was it like when you did your first bank robbery? And he said, I was so nervous I could hardly do it. And she said, well, what happened after that? He said, well, I took some Valium. It got a lot easier. Right? Creative ability. You know, I like to say, prisons are filled with good artists. You know, it doesn't have anything to do with criminal conduct. Physical conditioning is always my favorite. I don't really understand where we got the idea we want to get offenders in really good shape. We ought to have couch potato programs, to tell you the truth. I was at a boot camp once, and I interviewed a young man, and I asked him, what did you get out of the program? And he leaned in my face. He said, I'm in the best physical condition of my life, sir. And I thought, yeah, now he can run me down and kick my ass even quicker. This is an important chart, because what it is saying to you is that the more criminogenic needs you target, the stronger the effects. And there's a simple reason for that. Most people aren't high risk because they have a risk factor. They're high risk because they have a number of risk factors. Think about, let's take a simple one, employment. Employment. You think of parolee, you think in California being on parole or probation if you don't have a job, is that a risk factor? Huh? Yeah, absolutely. Absolutely. You're on parole in California, you don't have a job, that's a risk factor. Is that a risk factor for you? If you lost your jobs, would you start selling drugs? Mugging old ladies? Stealing cars? What would you do if you lost your job? You'd go find another job. Being unemployed isn't that big of a risk factor for most of us. But it would be if you said stuff like, I can make more money in a day than you make in a month. I'm not working for $10 an hour. My friends aren't working, they're doing all right. Now, them being unemployed is a big risk factor because they have those antisocial attributes and they have 40 hours a week to do nothing but get into trouble. But just being unemployed doesn't make you high risk for criminal behavior. So understand what this is saying is we can't, for higher risk offenders, this silo kind of approach doesn't work very well. You've got to have multimodality kind of programming because they have multiple risk factors. I got this years ago. It's a Christopher Columbus style of program design. When he set out, he didn't know where he was going. When he got there, he didn't know where he was. When he got back, he didn't know where he'd been. He came 4 times, and he did it on state money. These are not criminogenic needs, all right? So I want you copying these down, but this is some of the theories I've come across over the years. I won't go through them all, but some of my favorite, let's see, need to change their diet theory. That was a California one, all right? Here's a mental health program. They just wanted them to be happy. We had happy offenders in that program. But this is my favorite. This was a halfway house, this one here. This was a halfway house in New Jersey. And this theory went something like this. The reason us men are aggressive brutes is we're just not in touch with our feminine side. So this halfway house actually had them dress up as women in drag and go to group dressed in drag. So if you're ever mugged in New Jersey by an ugly-looking guy in a dress, it's probably one of their graduates. Now, I want you to know I don't make this stuff up. All right? So here are some of the ones, and this is right down the road from you. I don't want to make, well, I don't care. Anyway, dance program gets juveniles moving on the right track. And I'll read what's said. There in a small, secure, concrete area, young male offenders dance their way toward a new outlook on life. All right? Here's one. Running teaches inmates the value of success. I thought we didn't want them to run. All right? Here's one of my favorites, drum circles. Again, I'll read you. They introduced the first drum circle in a New Zealand prison, and she describes it as wow. That's the data they have right there, wow. The staff was amazed because most clients continued drumming for 2 hours without stopping to smoke. It doubles as a smoke cessation program. You can kill 2 birds with 1 stone there. Here's one man sentenced, probation, and yoga. That was for beating his wife. Eh? And here they are. I don't know what these knuckleheads are doing. They're meditating right outside of court. Yeah. And I got to be careful. I am in Santa Cruz presenting this stuff now, all right? You got to appreciate that, all right? Here's one. This is up the road from you, too. This is San Francisco. Gardening conquers all. How to cut your jail recidivism rates by half. 50% reduction. I'm amazed they have anybody in jail anymore. I did get a call once from some county that said they were going to do gardens for their offenders. They wanted to know what I thought they'd get. I said, vegetables is what you'll get. I'm ashamed to say this is out of my home county, Cincinnati. This is how they're fixing juveniles now. Circus clown trains troubled teens. So that ought to come in handy. You know, that's a big occupation there, you know, circus stuff. And my favorite, dog sledding as restorative justice method. And I love what they say. Exercising wilderness skills was seen as a way of rebuilding the perpetrator's self-esteem. So they're worried about how the perpetrator felt. I actually think these survival skills will come in handy for them someday. Because when they escape from prison, they'll be able to make it for a while out there on their own. All that is correctional quackery, if you will. There's no easy fix to changing somebody's behavior. If you think there is, try to change your own. It's not an easy thing to do. You know, give up a bad habit, lose weight, quit smoking, whatever. I mean, changing behavior is not easy. Okay? Not an easy thing. And so we shouldn't think that there's some panacea that we're going to, you know, that we're going to have people go out and garden and then all of a sudden they're going to see the light, you know, or they're going to do meditation or yoga. And a lot of these are good-meaning people because they love those activities and they want to connect with folks. And I understand that. Okay? And there's nothing wrong with those as activities. But I think you have to be very clear with the people you're working with on the differences between what are activities and what are core correctional programs. Because offenders often don't distinguish the two. They think, yeah, the yoga's great. Okay? Yeah, but it isn't going to teach you what you need to know to change your behavior. And so we have to be clear about that. Assessment is the engine that drives effective programs. Okay? You need it to meet the risk and need principle. It helps reduce bias. We want to evaluate and assess people based on what? Risk factors. Not based on race or ethnicity or gender or any of those kind of things. Okay? We want to look at them objectively as we can. Good assessment tools help us do that. There's no perfect assessment tool or system. But using these tools is much, much better than a clinical approach where you try to assess them yourself without, you know, what we call professional judgment. Okay? Basically, that's akin to what I call watermelon thumping. Okay? I explain what I mean. When I was a kid, my mother would send my father and I down to farmer's market in the summer to get a watermelon. My father would thump on every watermelon there, and he always got a ripe, juicy watermelon. He had the touch. And I remember saying, Dad, why are you doing that? And he'd say, to get a ripe watermelon. I take my 4 kids to Kroger's. I thump on every watermelon in the bin. My kids say, Dad, why are you doing that? I want to be a good father. I want to, right? And so I tell them to pick out a good watermelon. They all shake their heads. I don't have a clue. Half the time I get a bad watermelon. I'm not a good watermelon thumper. Some of you are good watermelon thumpers. You can sit down with an offender in 10 minutes, you got them all sized up. But that's not a very scientific way to assess people. And as that offender moves to somebody else, moves to a program, moves to someone, and they don't have those skills, guess what? They start all over, they miss things. And so assessment is critical. It's critical. It allows you to target dynamic risk factors. There are two basic types of risk factors, static and dynamic. And this illustrates it. These are factors associated with a heart attack. I cut it out of the paper one day because I'm in training for a heart attack, so I wanted to brush up. All right? Verse 3, family history, gender, mostly males, and age, over 50. 3 strong risk factors. Can you change them? No. They're static. They're static risk factors. You can't change them. These are dynamic, inactive lifestyle, overweight, high blood pressure, smoking, high cholesterol. Let's say you have them all. You go to your doctor. What's your doctor going to have you work on? The dynamic ones. The dynamic ones. Now let's say you have them all. Does it mean you'll have a heart attack? No, you might live to be 100. There's always outliers. Okay? But we can predict the probabilities. We know how many per 100,000 start having a heart attack. So let's say you work on them all. You start exercising, start jogging, lose weight, and so forth. That mean you won't have a heart attack? No. You see joggers keel over all the time. That's why I don't exercise, right? But as a group, they start reducing 20, 25, 30%. But here's the point I want to make. Even though these are the ones you target for change, to know your risk, you have to look at them all. Are you worried about having a heart attack if you're 20? No, it's not till age kicks in, right? So when we look at assessment, dynamic ones are very important for change, but we cannot ignore static risk factors. The past is always the best predictor of the future. So putting them together gives us the best picture. Okay? Static, dynamic. Dynamic are called criminogenic. We've already talked about that. But there are 2 types of dynamic risk factors. And the reason I'm mentioning this for a couple reasons. First of all, I often get asked by probation departments, how often should we reassess people, right? Somebody gets put on probation and you do an assessment. You give a risk, higher risk, moderate risk, you decide on supervision, you're going to do some things with them and so forth. And then they say, well, how soon should I reassess them? And my answer is always the same, 6 months. No sooner than 6 months. And they say, well, that's a long time. We want to reassess them sooner. Well, this is the issue. The second reason I mention it is I think it's related to the dosage issue. Okay. 2 types of dynamic risk factors. Acute risk factors. These are risk factors that can change quickly. How quickly can somebody get a new job? Next day, right? You could send somebody out to interview and they say, you start tomorrow, show up at 8 o'clock. They went from being unemployed to employed just like that. How quickly are you going to teach somebody how to be less impulsive? How quickly are you going to change somebody's friends, peer associations? Right? Not very quickly. Those are stable dynamic factors. They take longer to change. And so I'm telling you this because when you work with offenders, understand that some things we have to work on. It's related to dosage. It's why we can't get real quick results overnight because of this issue. These are some of the common tools. I'm not going to spend a lot of time on them. I want to use some to make a point. This is the LSIR. It's a commonly used tool. But here's what I want to show you. The LSI has 10 domains that it measures. It measures risk in all those domains. Here's an offender, high-risk criminal history, very high risk in companions, high risk in substance abuse, high risk emotional, and high risk in attitudes and orientations. This happens to be a woman. If you put her in a substance abuse program, if that's all you did, how much have you reduced your risk? Not very much, right? And so what I want you to see is how these are often interconnected. Most drug users aren't doing it by themselves. So we often have to go about targeting multiple risk factors if we want to get strong effects. This is the psychopathy checklist. You women will recognize these traits from men you've dated over the years. This is used to identify psychopathy. So if you think you have a psychopathic offender, this is the assessment tool you'd use. We've just developed a new one called the Ohio Risk Assessment. We made a speedometer. This is what the judges see. They get a speedometer, and then they get all the risk domains. And then over time, as the offender's reassessed, if they've changed, a new bar appears, so they can see very quickly are they going up or going down in the risk assessment. So these are some of the risk assessment tools that are out there. All right, I want to shift gears now in the last hour and talk about really the how, the tough part, the treatment part. It's not that hard to identify risk or needs. Good assessment tool will do that. A good assessment tool. Here in Santa Cruz, they use the strong at the adult level, and they use a PACT at the juvenile level. Those tools will tell you who's higher risk, what their risk factors are. That part's really not that difficult. We've been doing that, by the way, since 1928. It's not that hard to identify risk. Now the question is how? So I have a question for you. I want you to think of 3 speeches that have changed your life, not including this one. Okay? So think about, I'm going to give you a minute. Think about 3 speeches that have changed your life. They don't like dead time on TV. That's why I'm doing this. Yeah. All right, that's enough time. Most of you can't do it anyway. Anybody have 3 speeches that changed your life? Anybody got one? What do you got? What do you got?
Kennedy's.
Ask not. Okay.
Billy Graham.
Okay.
Speech by Bill Clinton.
All right, very good. Who do you have there?
Shirley Chisholm back in the 80s.
Okay.
Yeah.
All right. Anybody else? Yeah, what do you have?
Sermon on the Mount, and the time my dad said, I don't want nothing that don't belong to me.
Yeah, it's your dad, though. That had nothing to do with the speech. But Sermon on the Mount, there you go. Anybody else? Huh? Most common ones I get are Martin Luther King, I Had a Dream, or John F. Kennedy. So if you heard Martin Luther King, it might have changed how you looked at race. If you heard Kennedy, you might have joined the Peace Corps or devoted yourself to public service or thought differently about helping folks. But those are famous speeches. Those are famous speeches. But most of us cannot name speeches that have changed our life. That truth be told, I certainly can't. So I got another question for you. I want you to think of 3 people that have changed your life, and you really gave me one already. All right? But who are the people that have shaped and changed your life? Who do you have? Yeah.
Albert Bandura.
Okay, all right, social learning theory. There you go. Anybody closer to you? Yeah. Yeah. Daughter. Very good. Yeah, children really change your life. I have 4 still on the payroll. Yeah. Yes, dear.
A woman named Danny Hope, she introduced me to Buddhism almost 20 years ago.
Okay, a mentor, someone that helped you spiritually. Who else? Yeah. Come on, think about it. Not hard. Who do you have? Mother. There you go. All right. Who else? Yes?
The kids and the individuals I work with in the prison system.
Okay. All right. Very good. Parents, grandparents, children, aunt, uncle, coach, minister, teacher. Why are you doing what you're doing? Who influenced you? Who'd you want to be like when you were growing up? Spouse. I had a guy the other day had 3 ex-wives that changed his life. Said he wasn't getting married again. Just finding a woman that hated him and buying her a house. Why are you doing what you're doing? Who influenced you? point I'm trying to make is a very simple one. I'm trying to confuse anyone. What I'm trying to get you to see is how much more powerful social learning is than talk therapy, than a speech. You think that they've never had anybody give them good advice? Oh, no, they never had you give them good advice. That's why they're offenders. Okay? When we talk about the treatment principle, we talk about behavioral interventions focused on current factors, action-oriented, offender behavior appropriately reinforced. The most effective behavioral models are based on these approaches. Structured social learning, where new skills are modeled and taught. Social learning is not a theory of criminal behavior. It's a theory of human behavior. It's the process through which we acquire our attitudes, our values, our beliefs from people around us. It is a very complex process. It's not a complex concept. It's an easy concept to understand. Easy. How many of you have children? How many of you turned into your parents when you had children? You woke up one day, you're your mother. Last person you're going to be at 15 was your mother. Trust me on that. Okay? My youngest said once, when she's a parent, she's going to let her kids do whatever they want. I said, you go right ahead, Al, you just be home at 10 o'clock. I woke up on one day, and I'm my father. Okay? Saying things I swore I'd never say. You born in a barn? You think money grows on trees? I'll give you something to cry about. That was always my favorite. Okay? I said to my son one day, I said, Michael, do I look like Rockefeller? He said, who the hell's this Rockefeller guy, man? I said, I'm sorry, do I look like Bill Gates? Okay? The key words there are structured social learning. The problem with social learning is we don't just learn good things from other people, do we? We learn bad things from other people. Structured, new skills. Those are the key words there. And I'm going to show you an example of it in a little bit. It's best I show you how we do it rather than just talk about it. Family-based approaches that train family on appropriate techniques. Most of this is done with juveniles, although we are seeing more work done with adults. All right? We have California, you have some examples of where you're working with families. All right? But here's what I want to show you, though. These are some family-based interventions commonly used with juveniles, functional family therapy, MST, strengthening families, and so forth. The research indicates that the average reduction in recidivism from family-based interventions is about 21%. Not bad, not bad. But there's a lot of variability, a range of negative 17% to as high as 83% reductions. So what's the difference? The research is saying, hey, we get an effect, but gee, there's a big range. Well, guess what it is? Risk, need, and treatment. If you target higher risk families, you get a stronger effect. If you focus on their criminogenic needs, you get a stronger effect. Look at the difference here. Okay? And if you use behavioral approaches. If all you're doing is bringing the family in and telling them what you're doing with their loved ones, you're not going to get very far. You have to focus on what? Some of those risky problem areas like communication, problem solving. And what do you have to do? Practice. I always tell POs, you know, it's always fun. You have kids under supervision. Who's the mom call to fix her kid? They call you. What does that tell you? They don't know what to do. They actually have what we call learned helplessness. They've learned to give up. They want other people to take care of their kids. Well, that ought to tell you immediately they don't know what to do. You have to work with them and teach them how to do it. Script it out, practice. It's the same process. All right? So family-based interventions, you want to get strong effects? Pay attention to the principles of effective intervention. Cognitive behavioral approaches that target criminogenic risk factors. COG approaches. These are the principles of cognitive behavioral intervention. Thinking affects behavior. Antisocial, distorted, unproductive, irrational thinking can lead to antisocial and unproductive behavior. Thinking can be influenced. We can change how we feel and behave by changing what we think. It's a process here. It would take a quick example of how our thinking affects our behavior. I noticed here when I was coming up from the airport, parts of the freeway, the speed limit was 65. Okay? So let's say you're on the freeway and you're headed down to LA, you're doing the speed limit's 65. You're doing 75. What are some of the thoughts that allow you to drive over the speed limit? What are you thinking that allows you to drive over the speed limit? Everybody else is doing it. That's one. I'm in the 10-mile limit. That's number 2. Right? What else? I won't get caught. Right? There's another one. I'm a safe driver. I'm a good driver. What's an egocentric one?
I need to get there faster.
I'm in a hurry. Yeah, my time's important. I'm in a hurry. All right.
Special.
I'm special. It's a bad law. You know what? It should be faster than that anyway, right? So you got a bunch of thoughts that are allowing you to break the law. What's the big deal? Everybody's doing. If I slow down, they'll run over me. All right, there's no cops around. I won't get caught. I'm in the 10-mile limit. All right, so you've got a bunch of thoughts that are allowing you to speed. So there you are. You're doing 75. You're going down. What is it? 5 or something? I don't know what goes down there.
17.
All right, yeah, whatever. So you're heading down there, and there you go, right by the California State Highway Patrol. You go by at 75. What's your first thought as you go by? Oh, shit, that's your first thought, all right? Nobody's thinking I'm in the 10-mile limit anymore, are you? All of a sudden, you're not so sure what the limit is. You go by, you're thinking, uh-oh, what else are you thinking as you go by? What are you hoping? Hope he gets the other guy. Hopes he doesn't see me, right? Some of you are thinking of excuses, right? Get my badge out, put it near the license, right? All right, so there you are. You go by them, they pull out, lights go on, they're writing you a ticket. It's quota week. Okay. As he's writing you the ticket, what are you thinking? What is he? He's a jerk. Yeah, how come he ain't? I need to see the other guy, right? Why isn't he out getting real criminals? Right? So we're blaming him. Our first instinct is blaming him. What are we, by the way? We're innocent. We're the victims. We're unlucky, right? We got cut out of the herd. Right? Today's not our lucky day. Some of us are thinking of fighting it. I'm going to court on this one, right? Some of us are thinking, what's it going to cost me? All right, you got your ticket. You're 30 miles down the road. You look down at your speedometer. You're doing 75 again. What are some of the thoughts that allow you to speed again? It can't happen twice, right? That's one, right? What the hell are they going to do to me now? We call that fatalistic thinking, by the way. Offenders have that all the time. I'm coming up dirty. I might as well go out with a bang, right? So one is, what can they do to me now? The cop's behind me. Now I'm really late. Okay? You know what I always think? I'll be a smarter speeder. All right? I won't daydream. I'll get behind some trucks, you know, with radar detectors and stuff. I'll be a smarter criminal. That's what I always think when I get it, right? By the way, if it's not 30 miles down the road, it's the next day. Hell, we didn't even pay the ticket yet. We're speeding again. Now, here's the final question. What are some thoughts that might get you to slow down a little bit? What's some thoughts? Huh? Yeah, you know what? Safety. I don't want my kids to drive this way. I want to be a good role model for my kids. That might be one thought. What's another one?
The fine.
Fine, the cost, the ticket, the points, the insurance. That might be another thought. What's another one? It is the law. You know, it is the law. That's another one. I feel bad. I got to tell my spouse or whatever. So there's a whole bunch. Saving gas. I didn't get there any quicker. I was stressful, right? But the point is, to change your behavior, all I have to do is change a thought or two. That's what we call a cognitive restructuring problem. The reason it's called that is because I don't have to teach you a skill. Anybody can back off the pedal. Most problems aren't that easy. I'm going to show you a skill building problem in a minute on a short video clip. All right? But that's cognitive restructuring. But what is allowing us to speed is our attitudes, our thoughts. It's not a big deal. Who am I hurting? Everybody's doing it. When we get caught, we blame the cops. Doesn't that sound just like offenders? It's just different behavior. They're thinking the same thing. He wouldn't have bought it, he didn't want it. Who'd I hurt? What? They had it coming. And when they get caught, whose fault? It's the cop's fault, somebody's fault, not theirs. Then what are they? They're unlucky. They're not about the behavior, it's about their luck. About their luck. COG is popular, it can be done in any setting, any staff can do it, it's relatively cheap, there's a wide range of curriculums. This is the latest research on CBT. Average effect is about 25% reductions in recidivism, but the most effective configurations found more than 50% reductions. What didn't matter? The setting didn't matter. Juvenile versus adult didn't matter. Minorities or females didn't matter. And the brand name of the curriculum didn't matter. You don't have to spend a lot of money. What did matter? How'd they get from 25 to 50%? Dosage mattered. At least 2 sessions a week. That's a risk issue. Implementation monitored. And that meant somebody was making sure it was being delivered with fidelity. Staff were trained, more fidelity. Higher proportion of completers, responsivity, taking away the barriers people have, right? So they can't get there, you got to have transportation, or you got to figure out, maybe reschedule stuff. Higher risk, there's the risk principle, and higher if it's combined with other services. That's the need principle. They have more than one risk factor. Just because I change your thinking doesn't mean I've gotten you a job or done any of those other things that you need. Here's an evaluation we did a few years ago of Thinking for a Change. Thinking for a Change is a curriculum that's available from the National Institute of Corrections. We basically looked at probationers that got T for C versus just probation. What did we controlled for all these factors, and what did we find? Successful completers, 18% recidivism rate 2 years later. When we threw in the non-completers and just probation, that's a 50% reduction in recidivism. Yeah.
What's T4C and what is?
Thinking for a Change.
Oh.
Yeah, it's a curriculum NIC puts out, and you can get it for free. You can download. They use it here. I know they use it. Scott's telling me they use it here in Santa Cruz. But what I'm trying to get you to see is how the effects, we see effects in different populations, different samples. We see the effects. All right? So here's a study done on probation. Cognitive behavioral is not just cognitive. It's the behavioral piece. You've got the what to change, and you got the social learning, how to change it, model, practice, and reward. We often neglect or understate the importance of what I call behavioral strategies. Behavioral strategies include not only rehearsing and practicing with an offender, but reinforcing them appropriately. That means when they do the right thing, they have to know it's the right thing. When they do the wrong thing, that behavior has to be extinguished. Right? This is a new study that just came out looking at intensive supervision, and it's the first time. Most of the research on reinforcement comes from where? Psychology, human behavior studies, right? This is really the first study that looked specifically at a probation population and looked at the effects of ratio to rewards to punishment and the probability of success on intensive supervision. Okay? When the ratio began to increase, in other words, more rewards to punishers, success rates grew dramatically. Look at this. Look at this. Less than 10% to 80%. And what were the sanctions and rewards? Right? We're not talking about buying them a new Prius here. Okay? These are things: verbal praise, removed from electronic monitoring, level advancement, increased personal time, approved special activities, fees reduced, extended visitation. Here are the sanctions: verbal reprimand, written assignments, modify curfew hours, and so forth. These are all things that are at the disposal of most community correctional agencies. But it's training staff, it's listing them out, and it's making sure they're applied appropriately. And if they are, once that ratio hits, and it should be at least 4 to 1, that's where we really see the big advances. Okay? Look at dramatic increases in success rates. Dramatic increases in success rates. All right. For many years, I would have, my thinking was that most social learning programs were going to be done in a structured setting. Okay? Treatment program, even a residential, a juvenile hall, a camp, a halfway house, because you could shape that environment a little better. Recently, my thinking has been changing. And the question that we had was, how do we teach probation officers, parole officers, case managers, how do we teach them how to be agents of change? How do we teach them how to use social learning models, right? Because they're really at the hub of most of what we do, right? You know, people go to treatment, but they're on probation. People go here, but they're on parole. So that, we've started to pilot a new model. We call it EPICS, Effective Practices for Community Correctional Supervision. We've been doing it mostly with POs around the country. We've got 4 study sites, and we've got a whole bunch of implementation sites. And I'm going to show you a clip in a minute, but here's why we started to do it. Here's what we've learned. Most offender-officer interactions are not effective because, A, they're too brief to be effective. They're too brief. Conversations focus almost exclusively on monitoring and emphasize external controls on behavior rather than developing internal rationale for pro-social behavior. In other words, we tell them, you'll behave because. You need to do this because, instead of what? Teaching them how to do it. Mm-hmm. And the relationship's often more confrontational, authoritative in nature than helpful. One other thing that research has found on this: during those interactions, the more things you talk about, the less effective you are. Okay? Think about that. Right? When you got a laundry list you go through, your effects go way down. Remember what I said, speeches don't work, and if they remember anything, it's the last thing you told them, which is usually, I'll see you in a couple weeks. Right? Basically, we're following a structure. How do I say this? Think about individual work with somebody. Right? And a lot of programs, and this goes for you treatment providers as well. A lot of you would say to me, we do individual sessions with our offenders, right? Who knows what goes on in those sessions? How do you monitor quality? I mean, really, you have no way of knowing, right? There's no way of knowing. You could be working on actual problems, or you could be talking about sports, right? But why individual sessions? What's the big advantage? The big advantage is I can work on your problems, specific to you, not group work where half the offenders are sitting there thinking that doesn't apply to me, right? But how do we structure those sessions? And so what we teach the staff is to follow these 4 steps: a check-in, review what you learned last time, new intervention, includes practice, and then a homework. So it's a 4-step process. What we're doing in our study and training sites are, we basically have the officers record their sessions. And they send them to us electronically, and we listen to them, and we code them, and we give them feedback, and that's how we're doing it. But none of that's important. Right now, let me show you what we're getting, what they're seeing. Data from Canada, trained officers had 12% higher retention rates and reductions in recidivism. That's what the Canadians found. Federal probation is using the model. This is what they found. Actually higher effects with moderate risk, which kind of surprised us, but we think it's because the higher risk, the dosage isn't there. That's what we think, but we're not sure yet. So both sites are seeing some increases. I'm going to show you a clip now, because I found it, I could talk about it, but it's best if you see it in action. What you're about to see is a session with an offender. He just got out of a facility. In Ohio, we have these community-based correctional facilities. They're secure facilities. He was there about 4 months. He's a felon. He'd either be moderate or high risk. They only put moderate and high risk people in. And he's meeting with his probation officer. Okay? He's run into a situation, and he made a bad decision. Okay? You're going to see all the steps. This is what we call skill building. We teach the officers, there's like 4 skills that they can work on. Okay? This one calls for skill building. So he lacked the skill. He understood what he should have done. Cognitively, he got it. His problem was when he got into the situation, he did the wrong thing. Okay? And because he didn't know how to get out of it. And see if this is something some of your offenders would get into. But you're going to see this clip. The whole session takes about 13 minutes. And you're going to see her go through the entire 4 steps.
Thank you for coming in today, Charles. I really appreciate it.
How you doing today?
Good. I also want to say thank you for being on time. I know that every time you come in, you're on time, and I just want to let you know that really helps our day go well here because we have clients after clients, and it's nice to see you here. It's nice to see you on time.
Yeah, I try to do what I can.
Thank you. I want to just check in with you a little bit since our last session, see if there's anything new that's going on.
Yeah, just a little something about the homework that I have to do for you.
Okay. Well, let's hang on that. Let me check with a few other things, and then we'll get right into that homework.
Okay.
Any problems at work?
No, everything's splendid right there.
Everything's splendid there?
Yeah,
That's good to hear.
I'm glad I'm working.
Good, I bet you are. What about family?
Everything's cool. Mom was okay. Father's okay.
Okay, that's good. Any problems with drugs or alcohol since the last visit?
Nah, not actually.
Okay. And you're working, so I'm sure you're paying your fines and taking care of all that business
Oh
too.
yeah, I just made a drop off right now.
Excellent. All right, very good. So let's talk about that homework a little bit here.
Yeah, here you go.
Let's see. All right, so we definitely have a situation to talk about, huh?
Yeah, it was stressful.
Why don't you tell me a little bit about the external piece, the situation?
Well, it was since I've been out, I really ain't seen too many of my friends lately. So one of them all of a sudden just popped up. I don't know how he found out I was out because I ain't call him or nothing.
Where'd you see him at?
He came to my house.
Oh, so he knocked on the door.
Yeah.
That definitely goes against your plan to avoid everyone, huh?
Mm-hmm.
So tell me what you were thinking when he knocked on the door.
Well, I'm like, how did he know I was even out? That's what I was thinking at first, because I looked through the peephole. I'm like, how he know I was even home? I'm like, he always peer pressure me too. I don't like this friend right here for real, because he always trying to peer pressure me to do something. Even when I told him that I'm not doing that addictive behavior no more.
So you were thinking, what am I gonna do?
Yeah.
Yeah. So what choice did you make?
I opened the door and hollered at him. And we had a nice little conversation talking about the old days.
Yeah.
So he done peer pressured me once again, and I done went to the bar. There was smoke everywhere. He tried to get me to drink, but I ain't drink, but it was still a crazy situation that I really ain't want to be in.
Yeah. Sounds like you did well by not drinking, but you also put yourself at risk.
Heavy risk.
By going to the bar with him.
Mm-hmm. And all the smoke around probably could have got in my system. So if I got a dirty pee, I just told you why.
Yeah, well, we'll talk about that. We'll definitely have you drop the urine after this, and we'll kind of see where that goes. But
cool.
let's talk a little bit more about when he was kind of at the door and those thoughts you were having that led up to you deciding to open the door for him. Some of those thoughts were, man, how did he find me? How did I get here?
Mm-hmm.
But there were certainly some other thoughts that must have influenced you to
just
open
thinking
the door.
Just thinking about, we childhood friends, so I really could not open the door and holler at him.
Okay.
Then I was just thinking about some of the old days, good times we had. So I figured going to the bar wouldn't want to be too bad as long as I don't smoke or drink, even though it could be a trigger.
Okay. So those memories, those thoughts of the old days were kind of some powerful reasons why you decided to go to the bar. You still didn't want to get in trouble, so sounds like you were trying to manage the situation.
Yes.
Since you couldn't avoid it since he was right there.
Yes, ma'am.
Okay. Hopefully that urine comes back clean. As you
Oh, yeah.
said, you didn't smoke, you didn't drink, so that is good news. But, you know, this isn't going to be the last time that he probably comes knocking on the door, is it?
No.
No. So what are we
He
going to
said
do?
he gonna call me in a couple of days.
Uh-oh.
I'm gonna have to change my number.
So you already know he plans on trying to hang out with you again.
Mm-hmm.
So what I want to maybe talk with you about today is what we can do when he calls back, or maybe someone else shows up on the porch, or kind of, you know, some other high-risk situations from your friends that might just kind of fall into place like this one did.
Mm-hmm.
And we can talk a little bit about what you can do in those situations.
Okay.
Would you be willing to talk about that?
Sure.
Okay. What I have is one of the skills that maybe you learned in River City, or, you know, kind of like those skills, I should say, that you learned in River City with the active listening, giving feedback. There's a skill that falls into dealing with friends called avoiding trouble with others. And I'd like to just talk a little bit about, you know, how you can use that skill to maybe help deal with situations like this so that you don't end up at the bar, because, you know, this time you made a good choice once you got to the bar, but what if we can backtrack and avoid the bar altogether?
Mm-hmm.
So when you think about avoiding friends that can get you into trouble, or avoiding trouble with your friends, what might be one of the first decisions that you have to make?
First, just tell him that I'm not doing that no more, basically.
So
And if
before
he-
you even tell him, it sounds like to me you need to decide if being with him or doing that thing could get you into trouble.
Right.
Is that what I'm hearing?
Yes.
So you need to first make a decision, hey, this could get me into trouble?
Yeah.
Would you mind writing that down so we can kind of keep a step-by-step process of how to do that? So once you decide if this could get you into trouble, the next question is, I know it can get me into trouble, or it might not get me into trouble, but do I want to avoid it? Because it sounds to me like in that situation when your buddy showed up at the door, you recognized, oh man, here we go again. You know, I know this can't work out for the good, but yet, what happened?
I still went with him.
Still went with him. So we need something in there to decide, do I really want to make the different choice? Do I want to get out of this situation? So you think we could try that after that first step?
Yeah, we can try.
Okay, so let's maybe say, you know, is this the situation that could get me into trouble? And then next step, do I want to get out of this situation? Decide that. And then if you make the choice, I don't want to go to the bar, I don't want to get into trouble, do you think it's important to tell that other person that?
Mm-hmm. Yes, ma'am.
Okay, so do you think that'd be the next logical step? Tell that other person what you decided?
Yes.
Okay. And then sometimes people like to hear other suggestions. I mean, maybe you do want to hang out with your buddy, but is the bar the best place to hang out?
No, I just gotta tell him whatever we go do, ain't no drugs and alcohol involved.
Okay, so maybe a safer place. Could you make some different suggestions to where those safe places might be?
It could be my house, for real, because my mother don't allow smoking in the house, so
Okay.
she's a church woman, so that really would be disrespectful to do that in there.
Sounds like it. Well, then that would be one definite suggestion, too. What if he doesn't want to hang out at your house, though?
Well, let me see. We could probably go out to eat or something. Probably like TGI Fried Longhorn or something at a no smoking section.
But what about the alcohol they serve?
Oh, okay. I ain't thinking about the alcohol because I really ain't never drunk alcohol in no restaurants.
That's okay. Just something to think about. When you think about the other suggestions, you want to make sure that they're going to help you meet your goal of not getting into trouble.
Mm-hmm. Let me see what we can do. I never really thought about it like that for real. I had to get some thought to it.
Well, for now, you have your house. He can come in and you guys can hang out there. But if he still says, nah, man, I don't want to hang out at your house, I want to go to the bar, and he's really pressuring you, if you're going to avoid trouble with him, what's the bottom line?
Bottom line is to not even deal with him.
Then you need to not go, right? You need to tell him, look, then you go to the bar, I'm going to stay here at my house.
Mm-hmm.
So kind of the last step is, even if he doesn't take your suggestion, whatever it may be, you need to kind of stand your ground and do what's best for you.
Right.
So if that means staying at home and letting him go, that might mean staying at home and letting him go. So you think the last step could be doing what's best for myself?
Yes, that gotta be, because I can't afford to go back to jail.
Yeah, Something to keep in the back of your mind there as you're going through these steps. Okay, so we've got some steps down here now. Any questions on those steps?
Actually, that really helped me out.
Okay, so do you think it would help even more if I maybe role played? If I could maybe show you what those steps would look like?
Yeah,
and then maybe
we can
you
try that.
can give it a try yourself?
Yeah, we can try that.
Okay, so how about I play Charles? I'll play you, and you play your buddy.
Okay.
Okay, and you're trying to talk me into coming out and hanging out at the bar, and I'll use these steps to get out of this situation.
Okay.
And you took Thinking for a Change, right?
Yes.
Did you use this to kind of identify when you're thinking?
Yes.
Do you mind if I do that to kind of help show you the steps?
Yes.
Okay, all right. So why don't you start it off by knocking on the door?
Okay. Knock, knock.
Oh, man, here we go. I know he ain't just show up on my doorstep like that. I've been telling him I've changed. Oh, he could get me into so much trouble. I don't know what to do. I obviously want to open the door. He's a childhood buddy of mine, but, oh, man. I know this situation's going to get me in trouble. I know I got to get out of this situation. I think I'm just going to tell him that, it's great to see him. He's more than welcome to come in and hang out, but if he tries to pull anything, asking me to go anywhere, I just can't do it. Hey, man, how's it going?
What's up, man? Why you ain't tell me you was out?
I'm just trying to keep it straight and narrow this time, trying to do what I got to do.
You know what time it is. It's time to go to the bar, man. You ready?
I'm more than happy to hang out with you. Why don't you come on in? We can just chill here.
Well, we can go chill at the bar.
You're right, we can
We
chill
can't
at
do
the bar.
nothing in your house.
You're right, we can chill at the bar, but I'm trying to keep it together, so I'm going to be hanging out in here. I'd love to hang out and catch up with you if you want to come on in, but I can't go to the bar.
Oh, you gonna do me like that all these years?
It is what it is, bro. I'm sorry.
All right, I'm gonna call you tomorrow, man. I got something to talk to you about.
All right.
All right.
So what do you think?
That was excellent.
Well, thank you. So you think you can give it a try? Mm-hmm. Same situation, but you walk through the steps this time? Mm-hmm. Okay. All right. So I'll come knocking on your door. I'll be your friend. And this time you have to kind of go through your thoughts and figure out what the best thing to do is. You can make the suggestion of hanging out inside. Mm-hmm. And then remember just to do what's best for you.
Mm-hmm. Look through the peephole. Oh, here he go. Oh, what is he doing? I didn't even know I was out. I've been trying to change, now he's trying to come peer pressure me. I already know what he about to do. I can't get in trouble right now. I'm on probation. I got too much at stake right now. And I got a good job going. I got to tell him no, because that ain't the way to go no more. I got to do what's best for me anyway. What's up, bro?
Hey, where you been?
I've been working.
Working?
Yeah.
Why, you haven't called, you haven't said anything, we haven't even celebrated you being out.
I can't do that no more.
What do you mean you can't do that? Bar's right around the corner, everybody's there, let's head on up there.
That's too much addictive behavior. I can't be around that no more.
So what you want to do, you gonna leave me hanging?
Nah, I ain't gonna leave you hanging. We can chill in my house or something. Other than that, I gotta go to work in the morning.
You chill at your house?
Yeah, that's about it right now. I can watch my nephew anyway.
All right, I'm all right with that.
Okay. See you in a minute.
All right. So what do you think?
I think that's really worked out pretty well.
Yeah?
Mm-hmm.
Would you be able to try it outside of our office here in the session we just had?
We can do something. We can
Yeah.
try.
Well, what if, I know we have to meet again next week. I think we're meeting next Thursday again at 1 o'clock. So if we're going to meet again next Thursday, do you think you might have an opportunity to try that from now until then?
Oh, yeah, because he mess around and probably come to my house once again.
All right. Well, why don't you give that a try? And once he does that, give me a call.
Okay.
I know we're going to meet Thursday, but give me a call and let me know between then how it went. And then just in case it pops up again before we meet, we can kind of problem solve on the spot.
Okay. That's man.
All right. Thanks. Good to see you again.
You too.
What do you think? That whole thing took about 13 minutes. She went through all the steps. Again, that was skill building. He clearly, cognitively, he got it. He just, and he'd been through programming. I mean, he'd been through Thinking for a Change. But one of the limitations of doing, it's not that programming inside can't get effects. It obviously can, but the problem is you can practice and rehearse inside, but they really can't apply it till they come out. That's where the rubber meets the road. And in this case, He knew he shouldn't hang around with this guy. And you see how even he came up with some stuff. He said, hey, I got to go to work in the morning. I got to watch my nephew. I mean, he thought of some things on his own. So he's clearly on the right track. Now, of course, his plan is to stay away from all his friends, and that's probably not a good plan. In the long run, most people are social animals. And so what she needs to do is, over time, start to say, hey, maybe you can start finding some folks to hang around with where you're not getting into trouble. But you clearly see the process. That's what I wanted you to see, was the process. And you saw all the steps, pretty clear. Role playing is an area where a lot of POs really, that's something they don't like to do, but it's very important. If not, you're just talking through it. So you got to see the practice, and you got to see it all come together. Of course, these kind of approaches structure our interventions, teach and model new skills, allow the offender to practice with graduated difficulty, as well as the reinforcement part. And she reinforced him right out of the gate. But if his urine came back dirty, she was going to have to deal with that. There would have been consequences, and she would have responded. I want to just talk one very quickly. I know some of you work inside of facilities, jails or prisons, and sometimes when you work inside of a jail or prison, recidivism isn't job one. Right? I mean, safety and custody is job one, right? You want to get through the day, especially if you're a correctional officer or working inside a jail. This is from a meta-analysis done a few years ago that looked at misconducts. Violent misconduct, nonviolent misconduct, institutional adjustment, included male, female, and co-ed, included both adult and juvenile samples. And here's what they found. The strongest effect size for reducing misconducts by treatment type was behavioral programs. So if you run good behavioral programs inside of jails and prisons, you get the strongest reduction in misconducts. Non-behavioral, educational, vocational, and unspecified, almost no reductions in misconducts. In terms of number of criminogenic needs, the more needs you targeted, the stronger the effect. Quality, the higher quality programs got the strongest reductions in misconducts. And it varied by adult and juvenile a little bit. Treatment kept separate. That's always an issue inside of an institution. It's one of the reasons it's hard to do treatment often in a prison or a jail. In some ways, some things are easier. Everybody shows up. Right? That's the one easy part. But I remember a couple years ago I went to Corcoran State. You've got a large prison called Corcoran State. It's the biggest prison, I think, in the free world. It's got about 15,000 inmates. It's huge. And they had some treatment units, big treatment units in the prison. And they asked me to come and take a look at them. And what struck me was, because the facility was so overcrowded, the way this prison is designed, they have like housing units, like a couple housing units, and they're all in constellations. And they had moved a lot of general population inmates into this treatment area. So the men in treatment were basically intermingled with the inmates that were not in treatment. And it was interesting because when you were in the treatment unit, you saw a lot of programming going on. You saw inmates interacting, working on issues. The minute they hit the yard, they would separate. I couldn't talk to you, you couldn't talk to her because I'm black, you're Hispanic, he's white. The gangs were so pervasive that you just saw this disintegration of the treatment programming. Right? And that's what we see, by the way, in most studies. If you're going to do treatment in an institutional setting, you really have to figure out how to keep those inmates separate. It's not an easy thing to do always, depending on the physical plant and so forth. But here you can see the effect sizes were much stronger. All right, what doesn't work with offenders? I got this from my friends in Oklahoma. It says, Lakota tribal wisdom says when you discover you're riding a dead horse, the best strategy is to dismount. However, in corrections, we try other strategies, including the following: buy a stronger whip, change riders, say things like, this is the way we have always ridden this horse. This is the state's approach. Appoint a committee to study the horse. This is my favorite. Everybody does this. Arrange to visit other sites to see how they ride dead horses. Create a training session to increase our riding ability. Harness several dead horses together for increased speed. Declare no horse is too dead to beat. Provide additional funding to increase the horse's performance. Declare the horses better, faster, and cheaper dead. Study alternative uses for dead horses and promote the dead horse to supervisory position. We've talked about most of these. Programs that cannot maintain fidelity. I don't care what model you use, what curriculum you use. If you're dealing with a program where the staff always changes, leadership always changes, you can't get reports from them, forget about it. I've never seen a program. In fact, I can tell you from some of our latest studies, doing things poorly is worse than not doing them at all. We saw negative effects if programs were run poorly versus not doing anything. So you can get harmful effects if you're not doing them well. Shaming offenders, always one that I think pretty obvious really when you think about it. Any of you like to be shamed or humiliated? So what do you think you get when you shame and humiliate antisocial people? Pissed off antisocial people is what you get. Non-directive, client-centered, that just means let them decide what they want to work on, right? Most offenders, you're really talking about a directive approach, right? A directive approach is where, again, we're going to work on this. Okay? So I might bring a group in and say, tonight I want to talk about acting impulsively. Have any of you ever gotten into trouble because you acted without thinking? Right? A few of them might say, yeah. And you say, how about if I could show you some ways you might be able to get out of those situations in the future? That's I'm using some motivational interviewing techniques, but it's very directive. I'm not coming in and saying, what do you want to talk about tonight? Okay. It's around a specific risk factor, and we're going to do what? We're going to work on it, practice it, rehearse it. I'm going to give you some homework, okay, so that you have a plan for the next time you get into a situation. You can follow that. You can follow that plan. Have them read books, vague, unstructured rehab programs. It's important, I think, for those of you that are service providers, as well as for probation. I think it's important to ask your program to develop kind of detailed descriptions of the program. What do they target? What curriculums do they use? How do they vary dosage by risk? What kind of quality assurance is in place to make sure the program's being delivered right? Are discharge plans developed and so forth? And the reason I think that having detail about your program is important is because when you don't have that, your staff, you have no way to really monitor quality very well. And one of the things we know about correction business is there's always a lot of turnover. And so when you have new staff come in, what are they delivering? The last place they worked. Mm-hmm. And so it really behooves you to put together good descriptions of your program and what it is, because you want your program delivered. I'll give you another example. We are currently developing, we developed two things recently. One's almost done and the other won't be done for a while. The first is we developed a substance abuse curriculum. A cognitive-based substance abuse curriculum. There were some good ones out there, but they were very expensive. Training cost a lot. They wouldn't train trainers. And so we decided to develop one. It's going to be non-proprietary. It's at the printers now, and as soon as it's printed, we're gonna make it available to folks. But the reason we're doing it is because in the programs we're working at, we want that substance abuse curriculum to be structured. Because we don't want it to depend on just the experience of the facilitator. Because if you have a good facilitator, that's great. But what happens when they leave? They take the program with them, basically. The second area we're doing where it's even more of a need is sex offender treatment. Ohio Department of Rehabilitation and Correction asked us to develop a sex offender curriculum for them, and we're doing that. It's a big job. But here's what I have found over the years when I go out and look at sex offender programs. There's a lot of good sex offender programs out there, usually done by psychologists or folks that are really trained in that area. The problem is when they quit or move on, there goes the program, because it's based on their experience and knowledge. And if you're the one that needs that service, then you don't have a program. And so by developing curriculum, we're trying to solve some of that problem. Fidelity, again, I don't have a lot of time, but it's one of the tougher principles. You got to make sure the program's designed with integrity, ensure staff are modeling, are qualified, well-trained, well-supervised. Make sure barriers are addressed, but target criminogenic needs. Make sure dosage is provided. Monitor delivery of programs and activities. Sit in on groups. Give your staff feedback. Reassess offenders in meeting target behaviors. Track recidivism, having evaluators work with your program. All of these things increase effects. I've done a number of major studies in the last few years. The higher the program's integrity score, the greater the reduction in recidivism. Community supervision programs, poorly designed, poorly implemented programs, increased recidivism. And these are everything from intensive supervision to day reporting, the whole 9 yards. Well done programs, that's a 30% swing in recidivism. Residential programs, 22% reduction for high quality, 19% increase for low quality. Again, a 40% swing. So these are the lessons. Make sure, pay attention to who you put in a program. Risk is important. You can increase failure rates when you target the wrong people. Offenders have a lot of needs. And sometimes it's hard to sift through them all. 80% of what you do should be focused on the criminogenic needs. The further you get away from that percentage, the lower your effects come. They need other help, send them to social service agencies that help them in that area. Most of you, what we're working on is criminal conduct. Okay? And so it doesn't help that you help this offender in all these other ways if they end up back in jail or prison. That's our job one. How you do it's important. Practice, practice, practice. It's how most of us learn new skills. It's how they're going to learn new skills. You're going to show them, you're going to rehearse, you're going to practice, you're going to let them go do it. If they screw it up, you're going to bring them back and go through it again. Break it down for them. Where'd you go wrong? What did you do? How could you have done it differently? And there's nothing wrong with repeating that. Sometimes the more you repeat it, the better it is. Assessment drives effective programs. Follow the research. And when you're all done, you have to constantly worry about fidelity and making sure things are done the way they should be. All right. I got about 5 minutes, and so I'm gonna. Any questions you have, I'll answer them, and if not, we're gonna finish up. Yes, dear.
Hi, my name is Nina Stratton, and first off, if I had 2 nickels to rub together, I'd buy you a beverage of your choice. I'm really glad that you came today, and I wish you'd speak to Congress.
Congress? Yeah. Oh, yeah, right.
Anyway, so I can't have my gears spinning and listen at the same time. I'm gonna actually check out this community television, but I'm seeing you right now as basically as a resource with legs. So how can people find out more, and how can people follow up with
All right. That's a good question. Good question. It's a couple things, and I think. What's that? Yeah, she wanted to know how can she follow up and get more information about some of the things that are available out there. A couple things I'll say. First of all, if you're not familiar with the National Institute of Corrections, you can go to their website. They have a lot of material there, Thinking for a Change. They will help you if you're thinking of designing a program. There's also a website, if you go to Texas Christian University's Institute for Behavioral Research and Google it, they do a lot of work with substance abusing offenders. They put all of their assessment tools. They have a pre-treatment curriculum. They put all of that on their website. It's all free of charge. If you go to our website, www.uc.edu/criminaljustice, you go to our website and we put up studies and reports and things like that. You can always email me from there. Anything we do, that is the university, we usually make available. We don't put it all on the website because a lot of it's just too big. But any curriculums we develop, any assessment tools, usually these things are available to folks. And you can always email me and I'll try to help you if I can. But there are a lot of good sources out there for information. There are a lot of good folks doing work in this area. And I encourage you to take advantage. You don't have to reinvent the wheel for a lot of things. A lot of this work's been done. So you should be able to find it. Anything else? It's free now. You might as well ask me now. Yeah, go on.
What's the name of your substance abuse?
We call it cognitive, I think it's cognitive behavioral interventions for substance abusers. I said it's at the printers. It's a 36-session curriculum. It includes motivational enhancement, cognitive restructuring, social skills, and relapse prevention. 36 units over that period. And it's all, there's a facilitator guide and then workbooks for offenders. And we're going to probably put those in the CD. We haven't figured out some of that stuff yet, but it is finished. So we're going to get it out. We wrote it generically. But right now, I'm having somebody rewrite parts of it for juveniles because we kind of wrote it, you know, the examples are adults, so we're rewriting a juvenile version. I hope in the next few months to create an intensive version, add one that's a little more gender responsive for females. So, you know, but we're under a lot of pressure to get this out for the work we're doing. But what I hope is in a year we'll have several versions of this curriculum that's available for folks. Yes, anything else? All right, well listen, you've been a great group. Good luck with your work and thanks for having me.